Welcome to our comprehensive guide on chest physiotherapy. In this video, we'll explore the essential techniques used to improve lung function, clear airways, and support patients with respiratory conditions. Chest physiotherapy is a cornerstone in the management of diseases like cystic fibrosis, bronchiectasis, and COPD. By combining airway clearance methods, effective coughing, and specialized breathing exercises, physiotherapists help patients breathe easier and recover faster. Whether you're a healthcare professional, a patient, or simply curious, this video will walk you through the types, indications, and practical steps of chest physiotherapy. Let's begin by understanding what chest physiotherapy is and why it's so important for respiratory health. Airway clearance is at the heart of chest physiotherapy. These techniques help remove mucus and secretions from the lungs, making breathing easier and reducing the risk of infection. Common methods include postural drainage, percussion, vibration or shaking, manual hyperinflation, and more advanced options like autogenic drainage and positive expiratory pressure. Each technique is tailored to the patient's needs, ensuring optimal results. For example, postural drainage uses gravity to help drain secretions, while percussion and vibration loosen mucus for easier expulsion. These methods are often combined with effective coughing strategies to maximize airway clearance. Let's take a closer look at each technique and see how they work in practice. Postural drainage and percussion are classic airway clearance techniques. Postural drainage involves positioning the patient so gravity helps move secretions from the lungs toward the mouth, making them easier to cough out. Different positions target different lung segments. Percussion, often performed alongside postural drainage, uses rhythmic clapping on the chest wall to loosen mucus. This combination is especially effective for patients with conditions like cystic fibrosis or bronchiectasis. It's important to use correct technique and positioning for safety and effectiveness. Let's see some visual examples of these methods in action and discuss when they are most beneficial. Vibration and shaking are gentle manual techniques applied during exhalation to further mobilize secretions. The therapist places their hands on the patient's chest and applies a fine, oscillating pressure, which helps move mucus toward the larger airways. Manual hyperinflation, on the other hand, uses a resuscitation bag to deliver larger breaths, expanding the lungs and helping to dislodge secretions. These techniques are especially useful in intensive care or for patients with weak coughs. They can be combined with other airway clearance methods for greater effectiveness. Always ensure patient comfort and monitor for any adverse reactions during these interventions. Active cycle of breathing technique, ACBT, and autogenic drainage are advanced airway clearance methods. ACBT combines breathing control, thoracic expansion exercises, and forced expiration, huffing, to move secretions. It's easy to teach and can be performed independently by patients. Autogenic drainage involves controlled breathing at different lung volumes to mobilize mucus from the small to large airways. Both techniques are effective for chronic lung conditions and can be tailored to individual needs. They empower patients to manage their own airway clearance, promoting independence and better long-term outcomes. Positive expiratory pressure, PEP, devices and high-frequency chest compression, HFCC vests are modern tools in chest physiotherapy. PEP devices create resistance during exhalation, keeping airways open and helping move mucus. HFCC vests deliver rapid vibrations to the chest, loosening secretions for easier clearance. These devices are especially useful for patients who need regular, independent airway clearance at home. They're commonly used in cystic fibrosis care and can be combined with other techniques for best results. Always follow manufacturer instructions and consult with a physiotherapist for proper use. Coughing is a vital part of airway clearance. Teaching patients how to cough effectively can make a big difference in their ability to clear secretions. There are two main approaches: self-assisted coughing and manual coughing. Self-assisted techniques involve using the arms or body to increase the force of a cough, while manual techniques may require a caregiver or therapist to apply pressure to the abdomen or chest during the cough. Both methods are especially important for patients with weak respiratory muscles or neurological conditions. Practicing these techniques regularly helps maintain airway hygiene and prevent complications. Breathing exercises are fundamental in chest physiotherapy, not only for airway clearance, but also for improving ventilation and lung capacity. Techniques like diaphragmatic breathing, segmental expansion, and pursed lip breathing help patients use their lungs more efficiently. Diaphragmatic breathing encourages deep, relaxed breaths, while segmental breathing targets specific lung areas. Pursed lip breathing slows exhalation and keeps airways open, which is especially helpful during episodes of breathlessness. These exercises can be practiced in various positions and are suitable for patients recovering from surgery, those with chronic lung disease, or anyone looking to improve their breathing pattern. Mobilization and exercise are crucial for optimizing oxygen transport and overall recovery in cardiopulmonary patients. Even low-intensity activities, performed in upright positions, can significantly benefit those with compromised lung function. The choice of exercise and intensity depends on the patient's condition, goals, and current abilities. Safety is paramount. Always consider contraindications such as recent surgery, unstable medical conditions, or risk of aspiration. Regular reassessment and adjustment of the treatment plan ensure the best outcomes. By combining airway clearance, effective coughing, breathing exercises, and safe mobilization, chest physiotherapy empowers patients to breathe better and live healthier lives.